Welcome to the Advancing Maternity Care podcast. I'm Kristen Tully, founder and chief scientist. In this podcast, we invite maternal, infant, and family health thought leaders to share perspectives and tell us more about their work. Connecting around research and experiences is key for implementing more meaningful support for families and those who care for them. I'm so excited to be with Sara Hobgood. Sara brings over 20 years of experience in perinatal nursing and 15 years as an international board-certified lactation consultant. As an IBCLC, Sara has supported and encouraged mothers who desire to breastfeed to help build their confidence and promote positive maternal and infant outcomes. During her time as a bedside nurse, Sara's developed a passion for working with mothers affected by substance use disorder, and she's recognized significant gaps in the support that they receive. Sara, welcome.
Thank you. Happy to be here.
Great. Will you please share a little bit more about you and what drives your work?
Absolutely. Well, I have been a nurse for about 29 years, and I started out in pediatrics, and then I transitioned over to mom baby after I had my first child almost 24 years ago, and just really fell in love with all things moms and babies. And through that time period, we had a lot of moms that struggled with substance use disorder, and we were caring for them and their infants, and I just developed just a heart and a love for them. And the more time I spent with them, I could see similarities like in their background and my background as far as like childhood trauma. I've never had struggled with a substance use disorder, but I have struggled with like mental health, things like anxiety, depression, PTSD, and just getting to know them a little bit better, I just could understand them in ways that I think other people couldn't understand them, like what that means to not like have transportation or enough money to get some food to eat, or having your electricity or water cut off, like things like that. And just, being affected by, childhood trauma, I just developed this love for them. And the more time I've spent with them, just really could see where they struggle. And we've really come a long way, I feel like, in the support for this population. And that's just something to be absolutely celebrated. But we still have so much work to do. We're not anywhere close to being done. And I just have to say that these women honestly are some of the people that I admire most in the world. Absolutely.
That's really beautiful and powerful, Sara. Thank you for sharing how you know, how your personal experience, and I said our because, so many of us, like, we feel this deeply and we sort of identify with different aspects of what, matters most for folks. So thank you for being, open and sharing that, which is so special. And so, will you tell us more about what are you up to now, and what you've doing a lot of things, and so tell us about your moving parts and what excites you.
Absolutely, absolutely. So, like I said earlier, I've been a nurse for 29 years, and I never really had any dreams or goals to go back to school or do anything in the psych world. And you just never know where you're gonna be. Because right now I am close to completing my nursing doctorate and psychiatric mental health nurse practitioner degree. I just, through personal experience, professional experience, have seen just where our mental health system has a lot of opportunity to grow and improve. And it's just something that I felt very strongly that like I absolutely needed to do, just because of the experiences that I have. And like I don't know, like I can just understand and see barriers that people who struggle with mental health issues, I can see the barriers that other people really can't see or don't, it doesn't make sense to them, why somebody would do that or not do that. It makes sense to me. And I just have like a special heart and have gone through a lot myself and really want to do what I can do for people and families just when they're at that point where they're needing help. I mean, because it's just so hard, and there's just so much like shame associated with that, which is I'm finding is just like probably one of the most powerful emotions that there is. And so yeah, so I'm at NCW. I graduate in May of 2027, so I'm counting down months now, not years. And so just doing a couple different things. I still work a little bit as a bedside nurse on the antepartum unit. And I work a little bit at an organization called Tides, which supports women in recovery, like who are pregnant or newly postpartum. And they are just some of my favorite people to be around. And just in my experience, I had wanted to, I'm like, gosh, we really need to increase the education that we give these moms that come into the hospital, particularly the moms that struggle with opioid use disorder, because their infants have to stay a longer period of time and can go through withdrawal and can be very challenging to manage that process. There's just a lot of emotions, a lot of guilt, and just a lot of just being overwhelmed and exhausted going through that. And I started to see some ways that we could educate them and get them better prepared emotionally and just educationally wise. And just through that, this whole project I named it the Hope Recovery Project, and HOPE stands for Holistic Ongoing Patient Engagement. And the best, for lack of a better term, for some people to try to like process or figure out what this is, it's sort of like a case management type of thing, but I really don't even want to use that verbiage, but it's sort of like that, but it's not like any other like case management that you have ever seen. It's wraparound care for the women that struggle with substance use disorder. It starts at the prenatal visits, and it's just very different. It's built upon relationship building, getting to know them initially, because they have to build trust with you, and you can try to teach them things, but if they don't trust you and feel comfortable and safe with you, it's just not going to stick. And so it's a lot about relationship building, and a lot about asking them like what would be helpful to you, what is important to you during this pregnancy, when you have this baby and postpartum, like what would be helpful for you, because I feel like there are a lot of resources out there for this population, but there's a lot of gaps, and they're not really hitting the actual needs. And it's interesting that I'm learning that this population, particularly mothers with substance use disorder, are not ones to really speak up for themselves very much or complain very much, because there's just such fear of like retribution and the potential of losing their child or their infant. And so they don't really speak up for themselves. And so that's really very unique to them. And I really want to be their voice. And so Hope Recovery is about advocacy, education, and healthcare navigation. And basically that same advocate stays with them from that prenatal visit all the way at least until their first year postpartum, and helping them just learn everything that they need to do so that when they walk in to the hospital to have their baby, they are prepared. Like they know how to swaddle their baby. They know how to do the 5 S's of soothing. They know how to do some basic infant massage, and they know about skin to skin. And with all of these are things that are good for all babies, but especially if a baby is going through opioid withdrawal syndrome, it can be just completely overwhelming and paralyzing to know how to help your child, and they are riddled with a lot of guilt. And with this project, I want to do anticipatory guidance and kind of having them picture that moment where the baby is crying and they're like, gosh, I did this, but then also helping them to reframe that to like, what can we do right now, and putting that baby on their chest and helping them to see and like kind of being the voice for that baby. Like this feels so good to them. Like they're hearing your heartbeat, your warmth, your smell, like you are doing this for them. And just really helping them to feel empowered, just even with their like physical bodies and the things that their body is doing really well and the things that they are doing well, and just trying to point out things that others might take for granted that they're doing so that they can be encouraged and know that they are doing a good job taking care of their infants, and just a little bit of encouragement goes a long way for them. And so, yeah, so I'm working on that. I'm trying to get funding to be able to implement that. I have places where I'm implementing pieces of that, but I would love to have it put all together to do it, because I think it would really change things. There's a new initiative where before the women leave the hospital, we do a postpartum depression scale. And which is great that we're doing that. I think it brings awareness to postpartum depression and mood disorders, and it helps us talk about it a little bit more. But for this population, they're not going to, again, in fear of what is going to happen. Are they going to lose their child? I think that survey is done sometimes in childhood infant checkups and things like that, but they're never going to say, oh, I don't feel like I can take care of my baby. They're never going to say that. But if you have established a relationship with them and you've talked about, if this happens to you, this is what we're going to do about it. This is how we're going to support you. This is what's going to happen with your baby, and those types of things, so that if they are feeling really overwhelmed, they are feeling like they might be getting close to relapsing, they're going to be able to verbalize that and feel safe to do that, rather than just pushing and pushing, and then they just can't keep going, and then they relapse. And then, babies and children have to go into foster care, and then you start more trauma. And it's just to break that cycle. And so the whole idea of this project is to essentially keep these families together and help them live a healthy and joyful life, and then use that, their experiences to help others. And so I'm working on that, and I think it's interesting to see. It'll be interesting to see what I do when I graduate. Like, I definitely want to work with this population and be a prescriber for them. And as a nurse practitioner, I can prescribe medication, but I also am trained in therapy too, so I can weave a lot of that together to get to the heart of a lot of the issues that they're facing. So I'm working on that. And right now I'm starting my doctorate project. And so it took a while to figure out, narrow down what I wanted to do, because I have so much passion for this population. There's so many great things that we can be doing to increase the support that we give them. And so the thing that we identified was there's a huge knowledge gap in knowing the best practice for caring for not just people with substance use disorder, but mothers that are affected with substance use disorder, because there are a lot of things that are unique to that. And then infusing that education with trauma-informed care, because even though we are coming along really nicely, we are advancing, for that population, there still is a lot of stigma, a lot of judgment. There's a lot of emotion tied to, when you see like an infant struggling or things like that, there's a lot of like frustration towards that mom. And, and just learning how to, and I think a lot of people, when they are kind of being judgmental or punitive or harsh, they sometimes almost feel like that's their duty, that they need to be like that to maybe help that person to do better. But research tells us that's like not effective at all. And just really helping to equip them to be able to show compassion, show kindness, and with understanding. I mean, you still have to, they're still held accountable for everything that's happening, but just helping them along and encouraging them in a way that they can respond to, that they can keep going. Because, it just takes one discouraging comment to just have it fall apart. You would think just one little comment, it does. It can send them down. It just can send them down. But then on the positive side of that, being a person that is encouraging them, any kind word that you say, it means everything to them. It means everything to them. And they are a very, misunderstood population, I feel like. A couple little things that I want to, just share, that things that I didn't know coming along, but I've learned in the past few years just about the brain. Like, people who struggle with substance use disorder, their whole reward system, their neurotransmitters, like there's a lot of rewiring that's done. And it is definitely something that we need to look at more as a chronic disease rather than a moral failing. Like, I have this, let me see if I can find it easily. I have this quote: the Surgeon General and National Academy of Sciences, Engineering, and Medicine have underscored the need to address societal views that substance use disorder is a moral failing or a character flaw versus a treatable chronic medical condition. And I think we just need to understand that. And I think if we understand that, we're going to be better equipped to actually help them and use language that is going to support them in their efforts in recovery. The maternal reward system, for them specifically, they have a amplified stress activation. So like when their infants are crying, they experience more stress than a mom who hasn't struggled with substance use disorder. And they have decreased sensitivity to that natural reward system. So when they see their infant smiling and cooing at them, they do have a sense of pleasure and reward, but it's muted some. And a lot of people don't realize that. So that was interesting to find out. And mothers who struggle with depression, their infants sleep about 97 fewer minutes a night and wake up a lot more during the night than mothers who don't struggle with depression. And I thought that was also really interesting, which kind of leads me into talking a little bit about my absolute love for the Couplet Care Bassinet. I just happened to find a little bit of something written about it when I initially started school 4 years ago, I think, and was just completely mind blown by this bassinet. And when I saw it, I immediately thought of these women who, just to kind of give you a visual, I'm going to do my best to kind of give you a visual. Maybe you guys can picture a hospital room, the hospital bed, like a mom wearing like a hospital gown, and you see a room, maybe you can picture a little bedside bassinet in there. And their infants, the moms who have struggled with opioid use disorder specifically, even when they have been like in a treatment program and doing very well and in a very healthy place, they have that need to stay on that infant can withdraw from that, which is a big misunderstanding a lot of times, even in healthcare, that if the mom has been on something that's prescribed, that the baby isn't going to have withdrawal, but they absolutely can. And it's very difficult to predict because we're also different and have different metabolic, rates of processing medications. But all the infants will withdraw to some extent, and some are fussier than others, and they cry a lot, they tremor, and even if they fall asleep for a second, they're like woken back up like every 5 minutes. And so we've started some of the progress that we've made is this new scoring system we call Eat, Sleep, and Console. And it's really designed to keep that mom and baby together. It has shown that infants have needed a lot less medication management while they're going through that withdrawal. They don't have to stay in the hospital as long, and it's wonderful. However, that mom, one of the things that we're like, oh, do skin to skin? And the infant, they love being up on their mom's chest. However, that mom has got to have some time to sleep, and she can't keep that baby on her chest 24 hours. And what happens is they fall asleep in the bed with their infant, and which isn't safe sleep, and they, get in trouble for that and reprimanded more so than other moms without substance use disorder. Because all moms fall asleep in bed with their babies. I'm just going to tell you, as a bedside mother-baby nurse, this happens to pretty much every mom. But when it happens to this population, they're held to a higher standard but yet they're not really given many tools to help with that. And so then if they try to be compliant and put their baby in the bassinet, that baby can jolt and wake themselves up in like 5 minutes, and they can't really reach into the bassinet. It's too high. They can't reach their baby. And so then they have to try to get up out of the bed to get the baby. And even in those seconds, that baby is starting to escalate. And then it's harder to get them to calm down and all of that. And so then the mom's sleep is so interrupted. And when I found out about the Couplet Care Bassinet and got to play with it myself last summer, I was like, just like, hallelujah, this is just perfect and amazing and is just going to give them the chance to do what they want to do. And so it's so beautiful because you can just pull it over the mom's lap, and their baby, if they've gotten their baby to sleep and they're in the bassinet and they kind of jolt to wake up, they can very easily just pat their little bum, and because they love that, and they go right back to sleep. That mom can actually sleep in her own safe sleep space. That baby is in their own safe sleep space. And just having that mom's hand nearby, the warmth, the smell, it keeps them calmer. And if they do need to eat, mom can just reach in, feed them. And when they calm down and are done, they can just put them back in there. It's just, I mean, it's just a completely different postpartum experience. And because they haven't had to get up and then increase their pain and moving around and things like that, they're able to go back to sleep a lot better, them and the babies. And that is important because, for two reasons. For the mom, the more sleep that she can get, the more that reduces her risk of postpartum depression. And these women, the ones with the babies that have to stay extended for at least 5 days, if you could imagine being in the hospital, trying to sleep in a hospital for 5 days, even if you haven't given birth, is just exhausting. And then postpartum depression, that's going to increase their risk for relapse. So the more that these moms can sleep, that's great. And then they can feel good about themselves that they're being compliant. They're doing safe sleep. They're able to do it. And then the infants, because they're not crying as much, they're able to be calmed down. Infants that are going through withdrawal have a much higher metabolic rate. They require more calories, and the more that they're crying, they're burning more calories. And so the more that they can sleep, they're saving those calories and are able to spend that time growing. And so that just affects them, in all sorts of ways. And so it's actually very, very just practical, and it just makes that postpartum experience so much more enjoyable. You've worked so hard. They've prepared this nursery. They've gone to all their prenatal appointments, and then they've had this baby. And then, with traditional bassinets, they can't get to their baby, and they feel really bad about bothering you. And some of the moms will raise their beds up so that they can reach into the bassinet, which is very unsafe because then they're at a higher distance to fall themselves or their infants. A lot of hospitals will put the babies in a mama-roo, which is like a swing that kind of goes around to kind of help keep them calm. And it can be very helpful. However, its intended use is to be for an hour or so while an adult is monitoring them, because their neck, they can kink their neck, and it can be a risk for SIDS if they're in there. And so sometimes these infants, just because there's no other way to get these infants calm and to get these moms to be able to have like even an hour's worth of sleep, they spend a very long time in these, and so they're getting used to sleeping in a motion like way. They're not used to sleeping in a stationary bed. And so then when we send them home, I always kind of say this, it's kind of like, I don't know, silly to say, but these moms, we could have them complete a PhD in safe sleep, but it doesn't matter at all if they are at home and they cannot get that baby to sleep and the baby is screaming and screaming and screaming. That baby is absolutely going to go into the bed with them, which for this population, babies that have been exposed to opioids are at higher risk for SIDS. Just from that exposure. And so, it just creates a way for nurses to model safe sleep in the hospital, and creates a way for these moms to be compliant with safe sleep and feel good about what they're doing. And it's just a beautiful thing.
Sarah, this is amazing. You're in, and thank you so much for sharing how the Couplet Care Bassinet, is a piece of this story about respectful, supportive care and just better equipping people to navigate as they need to. And I loved your talk and your counseling and this whole program and standard of care that I think should be with all populations about how what wonderful things that our bodies and our voices and and our feeding, like just everything that we're doing is just so beautiful when it can work well. And so that's what we want to remove barriers so that people, as you just described, so that they know that, so that they're equipped with that knowledge. And then we want the environment to be supportive so that they can actually interact with their baby as they need to, and with these sort of high acuity circumstances. That's just everything. So
It is. And it's so much needed, because we've started, baby friendly and, we encourage rooming in, and we just, moms in general, we are not giving them the way to do that. We are saying these things, but then not giving them a way to do that. And it can be really frustrating. But this is just just provides that avenue to do it, do all the wonderful natural things and stay safe at the same time.
yeah, yeah, this is so great. And so, Sarah, maybe taking a step back, do you have reflections around, respectful care and what conditions help that? You mentioned some about when clinicians, that they can experience some judgment, and then they're wanting to be promoting, positive health outcomes, and so sometimes we don't have that knowledge or support maybe to be able to be aware and then to be trauma informed. Yeah. Anything else that helps with the healthcare team?
So just really my plan for, like I was talking about, my DNP project is to provide just very comprehensive education on mothers who struggle with substance use disorder, just like just neurobiology, just addiction as a chronic disease, and language that's helpful to use in general. And it's interesting because a lot of people who struggle with substance use disorder still use some of this stigmatizing language, but talking about like clean is one that always stands out to me, is, when I was clean, or, that kind of thing. But then if you're not clean, then what are you? Dirty. And so, you want to, just use different terminology. Just in recovery, you are, or you have had a return to use, instead of like, dirty, that kind of thing. Just saying like what it is. You don't have to describe it. You just say what it is. If someone is relapsing or returning to use, and just understanding that that's part of the recovery process, that is that can happen to them, and kind of prepare for that yourself mentally to I think a lot of people worry that if they invest in this population, what if they relapse, and all of that. And so if you've shown them empathy and compassion and kindness, and say, okay, they are, they have been manipulating you, or they are lying, or something like that, what does it really matter? What have you lost? Because your investment in making them feel cared for and treating them with kindness, it still stands, because their story isn't finished yet. And you want to do everything you can. Every touch point that a mom has with a healthcare provider is an opportunity to help them in that journey, to give them, help remotivate them, help them, I can do it. Because they do get really discouraged, and really wanting, and then in that education, I want to infuse stories of women that I know, and to tell their stories of what it was like for them, to help, nursing staff, healthcare staff, to be able to step in their shoes. Because it really is hard if you haven't experienced certain things. It's really hard to feel empathy, but just giving healthcare staff a way that they can do that, because we also, can get frustrated with healthcare staff about not doing that, but let's also give them a tool and a way to be able to provide the care that is needed and use the language. And, I look forward to the day that when all people in healthcare know sometimes when you work with patients, it can be frustrating and things like that with different instances. But I look forward to the day when behind closed doors, the healthcare staff that work with this population are not saying judgmental and negative things against them. They're just saying, hey, this is a challenge, this is a problem. What can we do to work together to help them? And just, yeah, because even if you think that you're being in front of that patient, if you actually feel that way down deep, it actually comes through. They can tell. You think you can't, you think you're hiding it, but they can tell. And what that does, just to put it into, it's not just making, when people talk to them like that, it's not like, oh, well, I just was discouraging to them, or I made them feel bad or something like that. It's so much bigger than that. The impact is, and the literature is very clear. Research shows that moms, when they have a history of substance use disorder or are currently using, there's so much stigma. They are very late to seek prenatal care because of how bad that looks on them. If you're a real mom or if you're a good mom, you wouldn't do this. And so they delay their access to care, which can be life-saving for them or their baby. And that's like a huge thing, that delay in care. And one thing that I just found out, in just doing some research for my project, that is really astounding. It comes from the North Carolina Maternal Mortality Review Committee. The most recent numbers, because it takes a while to compile and analyze it, but from the most recent report that's been put out has been from 2018 to 2019. And as far as pregnancy related deaths, the leading cause of death was related to mental health conditions leading to suicide and fatal overdose. So in North Carolina, the leading cause of death for the years 2018 to 2019 associated with pregnancy was mental health conditions. And, that's just something to keep in mind. If you took care of that person and you found out that, that happened to them, would you wish that you had said anything more encouraging? And so just think about those words, which you would want to say to them, to, in truthful words, but things that you can do to build them up, that they are doing well, and to look at them and make eye contact and sit down. Like, don't be rushed, spend time with them, let them talk a little bit, make them feel like they matter. It really makes so much more of an impact than you realize, because not only are you impacting the moms, you're impacting their infants and their children too. You're helping keep those families together.
Wow, Sarah, so important and so exciting. I can't wait to see what you continue and increasingly do. And I'm really cheering you on with this, with your work and this program, and that as you said, holistic and ongoing. And because hard things in different ways, they will come up for everyone. And so being there, being an ongoing resource and offering. I love the part too where you shared about, being proactive and sort of giving people maybe not the whole story, but outlining what this means, when this comes up, and sort of sharing that, because the power dynamics with anyone, let alone, with this population, those are always hard. We hear, as you've just described, the consequences are immense.
And just in all ways, with all people in general, but just I have found that educating moms, whether it be about breastfeeding or, diaper changing or swaddling, just all these little things that people might think are little, just education and learning about like what's normal and what's okay, and those kind of things can help be so empowering to moms and decrease anxiety. I mean, they're going to have anxiety, they're a new mom, but that can help decrease anxiety, a lot of the fear of the unknown, when they understand and see what's happening before them. And it just builds their confidence
Yeah.
that, maybe I can do this.
Yeah.
I can be a good mom that I want to be.
Yeah, and as you shared, patient safety and quality care, that includes psychological safety. We need to be able to be vulnerable. I mean, gosh, what is more vulnerable than giving birth in like
Yes.
in
Yes.
in every way. And so you need that. And so I'm so in awe, of the work that you're leading. Thank you so much for sharing a little bit about that.
Thank you, and thank you for your work. It's amazing. It's provided a way to, help these moms, and it's just so meticulously thought out. And yeah, thank you so much for your work.
Well, and I appreciate your ongoing, you're an advisor to Couplet Care, and, it's because of you and so many others where we've been able to listen about these things that really matter and then to be responsive to that, to offer something that fits and is helpful. So, it's good to be in community with you, Sarah.
Awesome. Thank you.
Great. I think that's wonderful. If if unless there's anything else that you'd like to share, Sarah.
No, no, I think that's it. I very much just wanted to share a little bit about, my passion and just how amazing these women are.
Yeah.
And I just encourage anybody who, is hearing this, or that just to, be patient, with someone who might be struggling with that. And then as far as like moms with substance use disorder, I mean, look at your local organizations. They always can use volunteers, meals, help with childcare, or even like just different activities, the things that they can do to learn a skill, tutoring, those kinds of things. Just spending time with them, is just such a huge thing that you would, give an hour of your time. I mean, that means something to them, and makes them feel like, I do matter. I am worth something. So those are some ways that people can volunteer. In Wilmington, we have the Tides program that I definitely recommend. You can go on their website and look. There's lots of opportunities to volunteer, and I promise you that if you do, you will definitely bless these women, but you will come away even more blessed and, on cloud nine and so excited.
That's great, and we'll link to that. Thank you.